Good day and welcome to Cornerstone PT Associates. My name is Jeff Richards, physical therapist, and I wanted to take a couple minutes to share with you the effectiveness of the Graston soft tissue mobilization system. This is instrument number 4 that we utilize a large amount of time on the lower extremity to promote myofascial pliability. I have an individual here who has significant degrees of tightness within both hips and thighs, and we're going to do a little pre and post Graston intervention to share with folks how effective this non-invasive massage technique can work to restore mobility and flexibility. So I'm going to simply have our individual rotate his big toes in towards each other, and there's his level of pre-Graston flexibility with significant tightness of what we call the hip external rotators, and then relax back out and try one more time, all the way, all the way, all the way. So a significant gapping of about 5 to 6 inches as we before we try the intervention. So we'll do his intervention over a couple minutes and then be able to compare for you shortly thereafter. Welcome back. I've completed 4 minutes on both of our individuals' gluteal areas up high here where the hip external rotators originate within the pelvis and in the deeper gluteal muscles. And now I'm working on a structure we call the IT band, the iliotibial band, coming off the top of his pelvis, really turning into a tendon right about from this bony bump here of the outer hip and extends all the way down to the outer knee. I'm using a slight lanolin-based emollient that allows us to let the instrument glide, but I'm simply using sweeping strokes initially for, again, approximately a minute or 2, depending upon the length and breadth of the structure of concern. But this is a very taut tendon band, and what you'll be able to perhaps observe within just a few seconds to less than a minute of the repeated stroking of the Graston instrument as we begin to bring out some capillary blood flow increases that turn pink within the top of the skin. This again is a non-invasive, very comfortable technique. Most folks, if anything, report initial tenderness over these tight structures, but certainly within several seconds to a minute or so of repeated fanning and or fanning strokes here or the sweeping strokes, we begin to get tissue relaxation, which results in associated pain reduction. Okay, we're going to pause for a moment and let our subject get onto his back, and we'll repeat our hip internal rotation test to see how impactful this no more than 10-minute intervention for both hips and thighs has been able to achieve for improving his internal rotation, which is going to translate into improving confidence in his gait. Pre-testing for internal rotation, just want to demonstrate that this is the width that I placed his feet at prior to the Graston intervention, and we saw we had about a 5 to 6 inch deficit. Now, sir, go ahead and roll your big toes in towards themselves. And you can see we've eliminated that 5 to 6 inch tautness within the hips, starting from the same pivot point of the heels. Go ahead and repeat that for me, sir. And then relax. We have a little residual hamstring tightness here that our subject is doing some therapeutic stretching for in conjunction with other home exercise activities that help. Go ahead, Dom, we can keep going with a few more. So this becomes an active stretch for our patients that helps to improve flexibility. We can even now spread the feet a little bit wider to enhance that stretch a little bit more. We don't expect the tissues or the toes to touch at this point in time, but the tight tissue stretch is certainly enhanced and completed more comfortably. So we thank you for visiting Cornerstone PT today. If you have any questions or comments about our presentation today, we'd be more than happy to hear from you through our Facebook connection, or you could simply call us here at Cornerstone PT at 895-6860. Have a great day.